Hello, I'm Dr. William Berger from Northeast Medical Practice. I'd like to tell you a bit about obstructive sleep apnea. So this is a condition you may have heard of and associate it with loud snoring and so forth. But there are a number of other characteristics of patients that can give them a predisposition to OSA. And so in that light, I'd like to talk about a little bit of a screening questionnaire that we use in medicine to rule out the probability of a patient having sleep apnea. It's called the Stop Bang questionnaire, and I'm just going to go through and read through the criteria to you. So the S stands for snoring. So this is loud enough to really be disturbing to someone. T for tired, and by that I mean what we call excessive daytime sleepiness. So you might fall asleep if you sat down to read a book during the day, or you've fallen asleep at the wheel during the day, and not a time when you just hadn't slept the night before. The O stands for observed, and that means has somebody else, like a partner you might have in your bed, observed you actually stop breathing for a moment or have an apneic episode. P for pressure, so that if you're being treated for high blood pressure, whether or not it's controlled, that gets you 1 point on the scoring. B for BMI, body mass index. So if you have a BMI that's greater than 35, 30 being where we make the diagnosis of obesity. If your age, so the A for age, if your age is over 50, and N for neck, so if your neck circumference is greater than 16 inches, so if your collar is greater than that, or if you actually go and measure around where the Adam's apple is and it's greater than 16 inches or 40 centimeters, and G for gender, so if you're male. So what I wanted to point out here with the Stop Bang is that you may meet criteria for potentially having high risk for moderate to severe sleep apnea, even if you don't have some of the classic what people think are associated with sleep apnea, such as loud snoring. For example, if you're really sleepy during the day, you have high blood pressure and you're male, you meet criteria. If you have high blood pressure, you have a BMI over 35, and your age is over 50, you meet criteria. High blood pressure, BMI, and you're male, you meet criteria. You'd have at least 3 points on the scoring scale. So in other words, snoring doesn't need to be in there, and also elevated weight doesn't need to be in there. There are plenty of people out there in the world whose the anatomy of their pharynx just makes them at risk for the airway to close while they're sleeping. For some people, it's positional too. And so avoiding sleeping on their back may be enough to decrease how much apnea they have overnight. And of course, there are many things that are associated with sleep apnea driven by it, beyond blood pressure, one of them being atrial fibrillation, so an abnormal heart rhythm that puts you at increased risk for stroke. So really every person should be screened using this questionnaire or one of the other similar ones that's out there to rule out them having a high likelihood of having moderate to severe sleep apnea. This is something that I do in my office, and I'm also able to order home sleep studies to actually make the diagnosis or to rule it out. And that is something that can be done for most patients. Going to the sleep lab isn't necessary for most folks any longer, and it's really a very quick and easy one-night procedure to go through. Not even a procedure really, just you wear a couple of sensors and you go to sleep and set it up with your app beforehand, and then you return the equipment the next day. So something that people really should be aware of. And of course, bear in mind that everything we talk about on these videos is for educational purposes only. No doctor-patient relationship has been formed. And if you have particular questions or concerns about your health, please don't hesitate to reach out to your medical professionals. But if you'd like to learn more about how we at Northeast Medical Practice in Great Neck, New York, can help you to optimize your health, including in the regard we've spoken about today, the number in our office, 516-604-3418, online at northeastmedicalpractice.com, our YouTube channel, and you can also check out our LongevityMD podcast on Spotify, where I discuss with other clinicians about the many ways in which one can optimize their health. But until we see each other next time, be in good health.